Mr. Chairman, thank you, and thanks again to Dr. Stone and his colleagues for joining us today. I'm perhaps exploring some of the things that Senator Tester just did, but I want to see if I can be specific or get a specific answer. Dr. Stone, in your written testimony, you provided the insight that the VA's allocation process to VISNs is similar to how HHS allocates the vaccines to the states. And that's, again, this population issue that Senator Tester just raised. Are the VISNs bound to this pro rata allocation formula when reallocating to the network of facilities they have within the VISN? So does the population, veteran population coming to the VISN, is that then translated into, in my case, Wichita, Topeka, and as same number based upon veteran population?
We have given discretion to the regional leaders to distribute to their healthcare centers based on refrigeration capacity and labor capacity to deliver vaccine. And therefore, that discretion has included the kind of thing you described in your opening statement, sir, that sometimes we find that we've got some extra doses and we may reach below a risk population to even a younger veteran. We know that the major risk of death and serious illness is based on age. And of all the variables, age seems to be the thing that stands out. And therefore, we have followed the CDC guidance, but there is the flexibility at the local medical center level to reach to a lower group of risk should they have vaccine available, because the transport of these vaccines is very difficult, especially the Pfizer vaccine. Now, in your state, the nearly 20,000 doses that have come into your state have been mainly in Moderna, and I'm sure Dr. Patterson can correct me if I'm wrong in that.
Let me ask, Dr. Patterson, let me ask this question to see again if I can get this answer. So does Wichita and Topeka get allocated based upon changes in conditions, VISN decision, or is it specific to we have this many doses based upon population and based upon the number of veterans that utilize Wichita and the number of veterans that utilize Topeka Leavenworth, that's how we allocate them?
It is a little bit in that way, Senator. Of course, we prioritize according to the guidelines we get from VA Central Office in terms of scheduling veterans to come in. But we don't have enough vaccine each week to do that entire broad population at one time. So what we have done is we allocate a minimum amount to each medical center. So for instance, Topeka and Eastern Kansas, Kansas City, Marion, Poplar Bluff will all get a minimum of 600 doses each week. That's the minimum. Now, if they have the ability to do more, or if they've scheduled an event, if we have an amount above that, which we generally do, then we supplement that. So they are prioritizing based upon the age group over 75, and then if they get all those done, first the CLC patients, then the over 75. If they need to go between 65 and 75, they do that. But as you referenced in your earlier comments about the event in Kansas City, we had 200 people not show up one night for vaccines. So we have standby lists ready to go. And we start calling those veterans. And I was out there that night at 8 o'clock that night and stayed until about 10. And it was amazing to watch the parking lot and people just pulling in, flipping off their lights and running into the building, even carrying their kids in pajamas sometimes to be sure that they could get a vaccine.
Again, thank you for that response, that response to the supply. Let me, the conversation that we just had, Dr. Stone and Dr. Patterson, lends itself to my next question. My staff's been informed that the VA's risk stratification framework includes vaccinating veterans based upon occupation starting in phase 1B with frontline and essential workers. So another way to allocate will be based upon what a veteran's occupation is. Are they an essential worker? Can you clarify whether it's VACO's guidance for VISNs and facilities to vaccinate based upon occupation?
I can. Certainly in 1B, frontline essential workers are identified by the CDC. So that's where that came from. As we've identified it, I think Ralph Gelati probably has the best story when it comes to that, of how they approached frontline essential workers. And Mr. Gelati, do you want to go ahead?
Sure. What we did was identify the various caregivers across all 8 of our healthcare systems, and then using the employee stratification, offer it to employees in order to ensure those that came in contact with veterans were eligible, able to receive the vaccine. And it's gone really well. And we have right now 76% of our employees have received a first dose, and many of that have received also a second dose.
I think I'm talking about the veteran's occupation, not the staff member's occupation, right?
Yeah, what I was referring to, and I apologize for catching Mr. Gelati on this one, was that they had identified and called veterans who were part of the local police department and had reached out to them and said, look, all the police officers in this community who are veterans, we've got vaccine for you as part of the 1B allocation, thus unloading the community to provide. And please clarify.
Yeah, that was with the Havre flight that we did in Montana, and that was with first responders from the Rocky Boy Native American Nation.
My time's expired, but I would ask this follow-up question. You can answer it later. Is there a way to verify a veteran's occupation to make sure that they are in the occupation that they say they are?